Looking at your client's dynamic posture now with a single leg squat test. We know that dynamic stability or joint stability is created by a coordination of the muscle contractions. So if there is any reciprocal inhibition between agonist and antagonist muscles, the client will not be able to achieve correct joint stabilization or alignment. This can lead to long-term joint wearing and short-term muscle compensation and injury. The single leg squat test takes very little time and it's quite easy to perform. It might also just prevent your client from being injured. This is due to muscle weakness and a subsequent predisposition to a certain type of injury because of that muscle weakness. When analysing the hip drop, you're quite simply looking to see if the hip on the opposite side to the stance leg drops during the squat. Have your client perform 4 to 5 squats to try and bring out any errors. Okay, so let's look first at which possible muscle weaknesses are linked to a hip drop. That way you'll understand why we suggest the 2 drill down tests above. So to maintain the hips at the same height during a single leg squat, the gluteus medius on the side of the stance leg needs to work in conjunction with the QL, or the quadratus lumborum, on the opposite side. If these muscles are weak, we'll generally see a hip drop. If one is weak, for example the gluteus medius, the QL may be able to compensate, however it risks being overloaded, which leads to back pain. So you can see why we've suggested the 2 tests above. The gluteus medius test is quite obvious. We'd like to know if the hip drop is coming from a weak gluteus medius. And the side plank test to test the quadratus lumborum. This is a modified version of the side plank in that we've stacked the feet. So when we stack the feet, this puts the load more into the QL than into the obliques. With the feet unstacked, then we load more the obliques. Just covering an anatomy too of the quadratus lumborum there for anyone who doesn't really know this muscle. This is a deep muscle, very, very important for spinal stability. It attaches onto the top of the pelvic rim, onto the lumbar spine, and up onto the bottom rib. In terms of which muscles will be tight or facilitated, we're looking at the adductor complex here, which then is causing the possible inhibition of gluteus medius, and the lateral calf. So with this predisposition to injury, if we have a client that comes in that wants to do some interval training, some sprints for example on the treadmill, and they do present with a hip drop, then they're at a greater predisposition of a lateral calf tear. So you're starting to see here how we can put in some prehabilitation exercises to prevent this from happening. For example, we would want to roll the adductors to release them, roll the lateral calf also to release it, and then strengthen what needs to be strengthened here between the quadratus lumborum and the gluteus medius. How do we know which one is weak? Well, we've done the tests above, which give us a great indication.